Nearly 200 Kent County doctors now on a list of providers participating in a new push to strengthen your family's primary care. It's part of a program started by Blue Cross Blue Shield of Michigan called Patient-Centered Medical Home, a new approach to medicine that requires doctors to more closely follow their patients' journeys through the medical system, from prescriptions to health management techniques meant to keep you out of the hospital. Let's turn it over to Sue Shaw with a closer look at this program. Sue?
Well, Brian, I'm here in studio right now with Jeff Connolly, president of the Blue Cross Blue Shield West Michigan operations, to talk a little bit more about this program. Thank you for joining us today.
Thank you. Good afternoon, Sue.
Well, tell us a little bit about this. It sounds like a real comprehensive approach to helping people with their medical problems.
Well, it's in its simplistic form. It's forging a stronger relationship between the doctor and the patient. Chronic conditions represent a significant cost of our health care, and we feel, and we've spent over 5 years studying a higher quality, lower cost by enabling a stronger relationship between the doctor, family care, pediatric, and the patient.
So what's the long-term sort of concrete goals of this program when you were talking about it over the 5-year span? Tell us more about that.
Well, it's twofold. It's improving the quality of care that's necessary, in particular in chronic disease. It's like diabetes. Managing a diabetic is still costly, $6,000 to $7,000 a year. A diabetic that is not managed, is not compliant with their meds, is $13,000 to $14,000 a year. So our goal is to bring and to lower the costs, but also to improve the quality of care that's necessary between the doctor and the patient.
How many patients do you think can be impacted by this program?
Initially, in the state of Michigan, we have over 1,200 doctors participating today. We hope that will grow, but that is affecting immediately almost 2 million Michigan residents.
So what are you hearing from the medical community about something like this?
Very well appreciated, long overdue. But it's a step in the right direction, and one that's really necessary to help protect the access that's critical to have the amount of doctors that we need out there to service the patients and their members.
Well, tell us a little bit, if a patient decides to go with one of these doctors and has diabetes, for instance, was your example, what can they expect in this over comprehensive, I should say, approach?
First of all, they can expect easier access to their doctor.
Okay.
Right now, a typical doctor will get in the office at 7:30 in the morning and do paperwork for 2 or 3 hours, and then have to see patients for 5 to 6 hours and do paperwork until 7 or 8 at night. Part of this is to enable the doctor to be able to see patients at 7:30 in the morning until 5 o'clock in the afternoon. So it opens up the gateway that's necessary to get into your doctor on a timely basis, and that's a significant hurdle that we've seen in the past.
So how are doctors responding to this? Is that going to free them up? Are they going to feel like they have to do more? I mean, it sounds like they're going to be able to really get in touch with the patients.
It's very favorable, and it's important that this program was not developed just by Blue Cross. It was developed by and with the doctors in the state of Michigan. So many of the doctors here on the west side of the state gave us input. And so this program is a culmination of what they have told us that they need to forge that relationship with the patient.
Now, if people want to get involved with one of these doctors on the list, one of the 1,200 in Michigan, how can they do that?
Simplest way to do it is to log on to bluecrossblueshield.com. That's bcbsm.com. And our list of doctors are available on that site, and as that list grows, we will add them to the list.
Okay. Jeff Connolly, thanks for joining us today. We appreciate it. And of course, that list of doctors will also be accessible. Just go to woodtv.com for more information on that. Brian?